Welcome again to Fit for Dermoscopy, and in this section we will talk about nails. I have a very deep respect about nails and lesions underneath or at the nails because we can't see everything. So in which diagnosis we have the most interest of our diagnostic eyes? This is the nevus versus melanoma, and then on the other side, for example, Bowen's disease or Bowen's carcinoma. So let us start melanoma versus nevus. At the nail, for me, the most important question is always, is there any complete longitudinal melanocytic? This is for me the most important question, yes or no. So therefore I have here marked this with three question marks. And so when we check lesions, I always, when I see the longitudinal melanocytic, I just put three question marks for me to check it is benign or malignant. So left lesion in this schematic figure, we see homogeneous brown small pigmentation. This is fine, nevus, okay? But here we start to have a kind of barcode, like I say. So it's a different type of lines, different sizes, different colors, something is different, And also we can see in dermoscopy the micro-Hutchinson signs. That means the pigmentation just on the skin, not underneath, but this is just on the skin, And then when it's going to be at advanced melanoma, we have this different types, destruction, so tumor caps. So let us go into images, clinical image and dermoscopic image, So longitudinal complete melanocytic, three question marks, benign or malignant, always rule out the malignancy. So it is homogeneous, regular, a little bit some different colors, a little bit, but this is absolutely correct, No way to do anything, But here's the difference, You see different type of colors, Also the size is bigger. This is the pigmentation underneath the skin, It is not in the skin. So this was a melanoma in situ, and you have here all the initial typical signs, dermoscopic signs for the melanoma in situ or invasive melanoma. 3 years old, this boy. So it is very rare, but not impossible, but very rare that this is a melanoma in this age, But nevertheless, check it, And you see this here, and you see here only a part of this longitudinal melanocytic, And okay, here is the initial barcode, the initial change of lines and colors and so on, but in the control it was less pronounced and the size has not been increased, And why it is, or what is the reason for this change, So this image, first image, left-hand side, was done in autumn, so after summer, after UV exposure, and this has been done in spring, so before sun exposure. So you see that there's always a possibility also to have an influence about the congenital nevi which are located subungual or in the matrix of the nail. So this is very important also to know when we check these lesions. So a benign congenital nevus. This is not benign. The total nail plate is affected. And have a look here on the top. This is a macro or macro Hutchinson sign. This is a pigmentation in the skin, atypical, and this is always a hint for the melanoma, always, or melanoma in situ, one of both, And I compare these different sizes, different colors of this longitudinal melanocytic as a barcode. So in my file it is noticed barcode, and so I know there are different lines, different colors. Nail destruction, I must rule out the malignancy, melanoma or squamous cell carcinoma, Bowen's carcinoma, I don't know what, but I must exclude. The hint for the melanoma is this brownish spot here. Yeah? Here's the Hutchinson sign. Yeah? So it could be melanocytic, yes, so I must rule out the melanoma with this polymorphia of vessels, and I must rule out the malignancy. Yeah? Also here, this is not an onychomycosis. Also there's an onychomycosis in addition, but there's a tumor. Which tumor? I don't know. I must do the punch biopsy or excision or what else. Yeah, I need histopathology, invasive melanoma. This case, yeah, I took this picture with my mobile because I had not my dermoscope with me when I visited friends, yeah, and a good friend of us showed me this lesion, yeah, longitudinal, initial barcode, and have a look here, Hutchinson sign, yeah, older than 50 years and new. What is it? It is clear, the diagnosis. When you enlarge the image, yeah, at the screen, yeah, you see here the Hutchinson sign and barcode and a little bit destruction of the nail, which is unspecific here. Yeah. This is not specific for an initial tumor. Yeah, just melanoma in situ. Yeah, very easily diagnosed with a mobile. Yeah, just take an image. Just apply a little bit something liquid on it. I use a little bit olive oil, yeah? So I can reduce the impedance, the gap between the air and the nail plate, so I can better look inside. Yeah? So melanoma in situ. Also, we can have longitudinal grayish colors, complete colors. Yeah, so we know this is a lentigo or lentigo and skin of color. Yeah, so a typical distinct lentigo here, or lentiginous nevus. Yeah, but it is benign. Yeah. And this is a man coming from India, and we see this more in, for example, Asians' skin, or also African skin, so that means I call the skin of color, yeah, and we can see this there more often, and this is a challenge, yeah, because we have also to rule out, yeah, a possible malignancy in the lentigo, yeah, so this is very interesting to see, and then to check it regularly, and when you doubt, you should take an image. This was done from this digit here, you take an image and you compare after 2 to 3 months. Yeah? But here, at this moment, I do not have any hint for malignancy, so it is fine. So hematoma, sub or intra-ungual hematoma, typical, yeah, with these spots here. It is not longitudinal completely. Yeah, this hematoma after 4, 5, 6 months, yeah, depending how fast it is growing, yeah, but it is long time ago, yeah. Subungual hematoma, yeah, very nicely to see and also confirmed here in dermoscopy, and also in the second digits is completely a hematoma, yeah. And also here hematoma, some times ago, perhaps 1, 2 months ago. Yeah, and here you see it is not completely longitudinal, absolutely not. Yeah, so here's a healthy and not from the hematoma affected nail, and so it is fine. Yeah, fresh hematoma. Yeah, and also not completely longitudinal with this typical streak-like pattern to the periphery, based on the pressure, and the blood is just pressing into the nail or under the nail plate. Yeah. And also a painful tumor, but it's a benign tumor, the Blum's tumor proliferation, benign proliferation of vessels, subungual, and when you press or you put something cold on it, yeah, it is painful, a little bit tricky to operate. Here an image from this, yeah, you see this, and the pressure and especially cold temperature is painful, and so you have the correct diagnosis. Also, we can have some infections, for example, onychomycosis, verruca vulgaris, typical common warts, yeah, or also bacterial infections. Yeah, this is typical for onychomycosis. It's a little bit like mountains. I call this a mountain pattern, which you can have here. Yeah, and also onychomycosis here, not completely. Yeah, and common warts, subungual, tricky to treat because we cannot reach them here under the nail plate. Yeah, also here common warts, and I just applied the dermoscope in front of the nail plate, and here you see the typical pattern of the common warts. Yeah. Also infection after this procedure here, yeah, and therefore, well, this artificial nail plates can affect this as a side effect, and well, it is tricky because here any possible infection can enter, especially mycosis. Yeah. So after work in garden with an injury and then with a bacterial infection, and you see this different type of colors. Yeah, and also here a combination of Pseudomonas infection and onychomycosis. Yeah, so all is possible in the way of different infections. But we have also the possibility of other in situ tumors or invasive cancer. Yeah. Also a little bit we need to know something about scars and onychopapilloma, and then bones disease and bones carcinoma. A scar after injury in the use still remaining here, and a little bit tricky because it can be affected by any onychomycosis. Yeah. And also here's a typical onychopapilloma. So it starts perhaps in the middle of the nail and it's going to the periphery, and when you take the dermoscope and you see underneath this hyperkeratosis, yeah, and often you see a little bit of bleeding inside, yeah, but it is a benign one. Bones disease under the nail plate, something is growing, something is different, patient is older, yeah, and you see this polymorphia of vessels. Are the vessels a little bit in line, parallel lines? It's an academic question. We need to do something. We need histopathology, and it was a bones disease, in situ carcinoma. Well, somebody was waiting, patients, doctors, I don't know who, yeah, and then is coming with this destroyed nail plate, with this tumor, and with this typical pattern. And remember, yeah, in parallel lines, pigmentations, or vessels, yeah, this is typical for bone disease, bones carcinoma, and then we need to do surgery, and it was confirmed as a bones carcinoma. That means invasive carcinoma. So for me, when I see longitudinal melanoma here, yeah, and with this triangle proximal towards to the patient, yeah, we have the good hint for the melanoma, and also with the Hutchinson sign. From the bones disease, we see this very often coming from the distal, from the periphery to the patient, yeah, and also infections are more common from the periphery, but there are also possibilities, especially after injuries, which starts in the proximal area. So these are my clues for the region nails. See you soon in the section mucosa or mucoscopy. See you soon.